Joining me now is MSNBC Senior National Correspondent Jansing, who is in Philadelphia. The Managing Director of Opportunity Labs, Dr. Mario Ramirez. He served as Pandemic and Emerging Threats Coordinator at HHS during the Obama administration. Also with me is 14-year-old Ty Dropic. He participated in a Pfizer vaccine trial at Cincinnati Children's Hospital. Everybody, welcome. Chris, I want to start with you. This is big news that younger kids might be able to get the vaccine soon, but you're focusing on slightly older, not quite kids, but older young people who are nervous about this or hesitant to get the vaccine. What are you hearing?
Yeah, teenagers and 20-somethings, the millennials and the Zoomers, the Gen Zers, are among the most hesitant to get the vaccine. There's a whole bunch of reasons for it, Katie. They range from legitimate questions about what are the long-term effects and some confusion after they saw what happened with Johnson & Johnson. Wear a mask, don't wear a mask, go to school, stay home. But there's also some crazy stuff out there on social media, like they're not really giving you a shot. They're putting a tracking device in there. So there are doctors who are on the front lines of this fighting COVID, now on the front lines of fighting disinformation, including here at Jefferson Health. A doctor named Austin Chang, who has amassed 400,000 followers on TikTok. He does what he has to do. He'll dance, he'll make jokes, he'll tell people how crazy it is, some of the things that are out there, all with the idea of informing them. He knows they'll listen. You take a listen.
I think that it's good to have an open discussion and to ask questions. I think that we often underestimate the intelligence of Gen Z, but I feel that there's a heightened social awareness among this generation. And if they're open to having a conversation and asking those questions, we're there to answer those questions. And that's the reason why many of us health professionals are getting on social media.
When you talk about these ambitious goals, you've got to go for the millennials. 62 million of them in this country, not to mention the Zoomers, millions more who will be eligible for vaccines. So the Biden administration is reaching out. They know that they have to do some work with this age group, including, you'll know, Next Gen America, Katie. On the campaign trail, they were very big at getting young people engaged. Now, starting next week, they're going to send out 1 million text messages to their followers, encouraging them to get vaccinated. But this is really just gearing up in a lot of ways, and it's critically important if the administration is going to continue to be able to set those goals and meet them, Katie.
Got to convince them in forums that they follow. Ty, let's talk about your decision to take part in this trial. What made you want to do it?
Well, my mom presented the idea to me, and she said that I could be one of the first.
Oh, I think we just lost Ty. We're going to try to reconnect with him. We'll work on that right now. Dr. Ramirez, I'll go to you. And I'll say the news that 12 to 15-year-olds can get vaccinated, there are a lot of parents out there who are breathing a sigh of relief. But there are also parents who even still might be welcoming this, are wondering, is it really a good idea? Are we sure it's safe? What's your message to them?
Yeah, so I think overall it's good news, Katie. We're hitting this place in the country, right, where we have about 45 to 48% of the population has had their first dose. Kids will add a significant population that we can vaccinate as well. But we're also running into this place where vaccination rates are slowing considerably. And at the same time that those rates are slowing, we're trying to reopen things back up. And that includes everything from workplaces to entertainment venues to classrooms. And so the question is, if we run into places where people are more hesitant to take the vaccine, what's going to be our strategy to adjust for that? If we're going to reopen workplaces, do we use employer-based testing? If we're going to reopen schools, should we use school-based surveillance? And there are good organizations like We Act and Rockefeller Foundation that are doing work in this space. But the question is, if we're going to get to this place where people are more and more hesitant about vaccines, what's going to be our strategy to deal with that?
I got a question for you, though. How do you decide that 12 is the cutoff? What's the difference between a 12-year-old and a nine-year-old? How do you decide the age ranges for these trials and then also for the approvals?
Yeah, so pediatric drug trials actually follow sort of a series of steps. As you're lowering the age, they typically group people together in bands that are based on their physiology and how their immune systems develop. So usually when you're lowering the drug trial age, you go age 12 to 16, and then the next cohort is usually, I think it's 8 or 9 to age 12, and then the next cohort is the group younger than that. So it's actually based on, sort of stepwise fashion that is based on how pediatric physiology develops.
Ty, I think we have you back, so I'll ask the question again. What made you want to be a part of this trial? We're just having really bad luck with Ty, unfortunately. We'll try again. Dr. Ramirez, one of the other things that it struck me today and is striking a lot of parents is the rigidity of the guidance from the CDC for summer camps. Everybody masked outdoors in the middle of July, even if you're vaccinated. It seems untenable, unworkable.
Yeah, it is difficult, Katie. And it reminds me of what the situation was like when I was working at HHS during the Ebola outbreak. And one of the things that I, am continually reminded by was just how hard it is to make public health guidelines that keep up with the science on the ground, right? And so I promised that CDC officials have been evaluating these guidelines for weeks and trying to do the right thing and protect the public health. And at the same time, we're seeing changes in, the spread of the disease on the ground, and it's very hard to keep up with that. And so, I think CDC is doing their best to keep up with, what we recognize as disease outbreak, and they're continuing to update those guidelines. But so often it's not quite fast enough with what the public wants to see. I think as an organization, CDC, has been maligned through a lot of this pandemic, but I know that there are hardworking people there who are trying to do the absolute best they can to keep the public safe. And I think they're going to update these guidelines in time. We just have to be patient with them.
What about the use it or lose it strategy the Biden administration will now reportedly employ?
So I very much agree with this policy, right? And this came up, in Michigan a couple of weeks ago when Governor Whitmer was asking the Biden administration to surge vaccines into the state there. And, at the time they were using just a population-based strategy and said they weren't going to change that. Now, several weeks later, we're at a different place in the pandemic. So we have several states that are either turning down orders or slowing their orders for vaccines. But there are other areas that definitely still need them. And so it makes good sense that if folks just don't want to take the vaccine or we need to do more work to convince those people, then we should at least get those vaccines into the arms of people who are ready to take them. So I think it's a good idea. As a whole, it moves the country closer to a state of immunity. So very much supportive of that decision.
Ty, we're going to try one more time. I hope you can hear me. Why did you participate in the trial?
Yeah. So my mom presented the idea to me, and I thought it was a really good opportunity for people my age to start getting the vaccine and getting vaccinated. And once a lot of people my age get vaccinated, hopefully the curve will go down and we can go back to getting masks off, stopping temperature checks, hanging out at friends' houses, and all that stuff that we used to be able to do before COVID hit, but now we can't do due to COVID.
So oftentimes adults are completely out of touch with how to reach children. What do you suggest? What's the best messaging campaign to reach kids your age, Ty, to convince them to get this vaccine?
Well, kids my age, what we really want to do is hang out with friends and go over to people's houses and party with other people. So I'd say if you get this vaccine, that's the first step to going back to seeing other people and hanging out with friends and all of the stuff we used to be able to do.
It's exactly what I think the rest of us want to do as well. Ty Dropic, thank you so much. I'm so glad we were able to fix that connection. Dr. Mario Ramirez and Chris Jansing, thank you guys as well. We also have to talk about the new travel restrictions between the United States and India that are now in effect as health experts race to keep that country's terrible new wave of COVID from coming here. The devastating surge of coronavirus in India is getting worse by the day. They now have more than 20 million cases. Hospitals are at a breaking point, overwhelmed with the sick and the dying, and critical life-saving supplies are now running low. Sky News correspondent Alex Crawford spoke with Dr. Sumit Ray, who runs Holy Family Hospital in New Delhi.
We are totally overwhelmed by the numbers. It is not our will to work or fight or do the things that we need to do, but the numbers are overwhelming. As in one single hospital or institution, you can do this much. We have reached the limits of what we can do as a hospital. So the next, it should have started earlier, is that the government has to intervene in more ways than just providing oxygen.
In the United States, many Indian Americans are desperate to find help for their families thousands of miles away. Communities like this one in Seattle have banded together to organize relief efforts, sending supplies and coordinating support for relatives abroad. Joining me now from Seattle is MSNBC Medical Contributor Dr. Vin Gupta. So, Dr. Gupta, I know you're a part of this. Tell me what's going on and how it's working.
Good afternoon, Katie. There is an utter feeling of helplessness manifesting as desperation with all these activities. You're seeing across the South Asian diaspora, here, across the world, frankly, this desire to get supplies to India as quickly as possible. Life-saving supplies, Katie. We caught up with a gentleman, Kamal Garg, yesterday. He actually went to extraordinary lengths to get his sick cousins in India oxygen concentrators. This is what he said when we spoke to him, and it was really moving bit here.
Of course we feel guilt when we think about our family suffering in India, and we've had the privilege, I'm fully vaccinated, we feel safe and secure, and if something had happened to our children, we would be able to rush to the hospital. And look at my cousin, who's near my age and in a similar situation with 2 children, and I wonder how the fear that must go through her heart.
Katie, it cost him $3,000 to purchase 3 oxygen concentrators that will take at least a week to get to India to save his cousin's life. Probably hundreds of dollars just to get the shipment secured to him in India. That's desperation. That's what all of us in the Indian American community are feeling. And that's what you're seeing with this cascading crisis.
So what we're hearing from doctors out there, Dr. Gupta, is that they need more than just medical supplies and vaccine, obviously. They need people, they need doctors. Any consideration being given to American doctors, American emergency workers going out there and trying to help, much like doctors from around this country came to New York in the middle of the crisis here last year?
I'll say, this is what I'll say, Katie. This is me putting on my Air Force reservist hat. There is a capability for anybody in the Biden administration listening right now. It's a mobile ICU capability. It's called critical care air transport. We usually don't deploy mobile ICU units worldwide, but Katie, the nature of the threat has changed, and we should consider doing that. We have forces ready that could help. To your point, if we set the example, then other countries will follow. So yes, absolutely, we should be doing more in terms of leveraging our medical assets in the military right now. Number 2, C5s and C17s, Katie, can deliver much more in the way of oxygen canisters than your ad hoc individual. So our Air Force capabilities could absolutely be rendered more useful to get more oxygen where it needs to be. And then lastly, the patent limitations, patent infringement laws are making it impossible for India to scale its own domestic production of vaccine supply. We need the Biden administration to lift any patent limitations right now, especially for the J&J vaccine, which is being considered by Indian health regulators. Once that gets approved, let's lift those patent limitations so we can get more vaccine in, so we can actually deal with this crisis meaningfully.
Dr. Gupta, thank you so much for joining us with all of that.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.